when does this implantation happens? It happens between 6 to 12 days post OV. Did you people get me? I want you to understand this, please. I can ask you to ask question before I continue, before I'll tell you the sign. I said after, if you OV, if you have OV, if you have OV today, mark it in calendar. Be from today till maybe 7 to 12 days. If you notice any of these signs that I'm going to talk about now, say you don't carry belle. Please, do anybody have, do I need to refresh on something? Do I need to refresh? Please let me know. Okay, let's start. Let's do it like this. Let me bring you people together. What did I say implantation is? Let me see. I'm waiting for you people. What is implantation? What is implantation? And how many phrases did I said we have? So you guys will understand. If nobody answered, I will know that you don't understand what I'm saying. What did I say that is implantation? Can you people hear me? What did I say that is implantation? Please, can somebody go out and copy Linda's TV show page and drop it here so that people will help me to follow the page? I'm waiting for you people, except you don't want us to treat this topic. This is a very important topic. What is implantation? What did I say is implantation? Okay, somebody, Mary, say 4 phrases. You would have named them now. You've named them. 4 phrases. Now, I asked 2 questions. I said, number 1, what is implantation? Number 2, how many phrases do I say we have in a circle? You all are just writing 4. Mention them. What did I say that is implantation? If you didn't answer, it means that you didn't understand what I'm saying. What did I say that is implantation? Who will go out and copy the page, a link, and post it here? What did I say is implantation? Angel Chinyere say it happens between 6 to 12 days here. But you have not tell me, what if somebody is just joining us now, the person doesn't know what we are teaching, we are just saying implantation. How would you explain? This means you guys did not understand what I explained about implantation. What did I say is implantation? Margaret, if you write, I will block you. I am asking questions, you are here answering me. Oh God, these people are making me to be angry. You are just coming here, we are learning, you are asking me questions. Have you answered the one I asked? Please, implantation is a sign that you have. No, I disagree. It's not the sign. It's one of the signs, but that is not the definition of it. That is not the definition. You tried, but it's not if a learned person sees this, it's part of it, but not the full this thing. Okay, marriage. Thank you. Marriage say the okay, menstrual cycle, follicle, phrase, ovulation, and it starts from your menses. Menses is one of it. Menses, you enter follicle, OV, and luteal. It starts marriage. Did you get me? You tried. You mentioned 3. It's 4. Your menses is the starting. Implantation is the meeting of OV and organ water. No, you see, you guys didn't get me. Thank God that something touched me to ask this question. It's when the zygotes find its way to the fallopian tube. Yeah, but not complete. Not complete. Implantation is the process. No, it's not the process of fertilization. Fertilization is fertilization. Fertilization is fertilization. I need somebody to give me comprehensive. You see, thank God that I even asked this question. I would have been talking to myself today. I just said it. Is it the grammar that I use? That's why I know they speak big grammar. You guys tried, but no, that is not. What if somebody asked you this place, this woman, the lecture you are going, what did you learn? What did she teach you? Say implantation, signs of implantation. She will ask you, what did she say? If you say all this thing, they go say the woman no olodo, and God go bear me witness. No be, I no be olodo, I no be olodo. Implantation is when a fertilized egg attach itself. Yeah, who is this? Ijoma Eke Raphael. God bless you. Ijoma, did you copy from Google? Did you steal? Ijoma, you are here. Answer me. Did you steal the answer? Ijoma, super. Congratulations, you win award. I will give you €1. Ijoma, I will dash you €1. Ijoma, this thing you get now, you are free to ask me question in Messenger. Ijoma, you prove me right. You ask me when you write me, when you ask me anything in Messenger, tell me that you are Ijoma, so the one that answers question. You said implantation is when a fertilized egg attaches to your urine. It's not urine or uterine lining. When I gave example, that's why when I teach, I try to make example. For example, now you OV. Now let me repeat myself again, or let me use the research is implantation is a process that occur after an embryo that is fertilized egg. Embryo. Once the egg is fertilized, it turns into what is known embryo or zygote. Now, when it turns, I told you guys that when you OV and the organ water touches the egg and fertilized it, immediately it is fertilized, it turns to zygote or embryo, it becomes automatically human. Now, this embryo stays in your womb for 4 days, roving about. On the 4th day, it will start traveling. It would start traveling down to your fallopian tube where it is going to attach. Now, when it attaches, when the embryo, because it's become a human being, it's not an object. Once this embryo attaches itself, stays, lie in bed, then that is implantation, which means it have implanted, it have stayed, it have lied down, it is settled. I don't know which other thing I go use to explain this. So the researchers said it the same way I said. They said implantation is a process that occurs after an embryo, that is fertilized eggs, travel down to the fallopian tubes and burrows deep into the lining of the uterus, where it will remain until delivery. Once it attaches itself in the uterine lining, it's not going anywhere again. It's going to stay. That is its bed. That is the home until after 9 months. So, have you people understand it now? Please, we are friends, not even friends. We are sisters. Don't forget some. I don't mind my face. If you are in my position, you'll be the same. Please, if you are not clear, I don't want your data to be a waste. If you did not understand, please tell me. Let me see if I can repeat it again. Let me see if I can refresh myself again. I want you to understand that meaning of implantation. It means, for example, let me say this is your crop, like ugu, vegetable. You want to plant it as it is like this. You have not planted it, right? Until you dig a hole and put it inside. You cover it according to the way farmers do. You cover it. That is when you say you have planted that, right? The same thing applicable. Do you people understand before we proceed? Do you people, or you have question? Somebody say implantation is the process where the man water meets the woman's ovary, but no. Please, if you don't understand, let me know. Please. If it is the only definition I teach today, I'm comfortable with it. I like people to learn. Please, if you don't understand the definition of what I said, let me know. Okay, let me repeat again. You people should not copy that person that got the definition. Can you now tell me from your own experience, what do you understand about implantation? Please, from your own personal experience, what do you understand about implantation? Please tell me. Tell me. Don't use Google. If you use Google, I will know. If you use Google, I understand Google English. Me and Google, we are friends. So if you use Google English, I will know. I'm waiting. Oh, I'm waiting. Can you people tell me what you understand by this implantation? Somebody want to join? If you like, so learn today. Oh. Tell me. Somebody should tell me. What do you understand? I want you people to understand, because if you don't understand this thing, the other things that I'm going to be saying, you will not understand. If you don't answer me, I will not go. I will not go further. If you don't answer me, I will not go further. And my eyes are on the comment section. What is implantation, please? You guys should share the video. I beg one person to go out and share our link. Nobody do that. No, everybody want to learn. I know, but one person can do that. Good afternoon, ma. Una no wan answer me. Like I stay here and I make una dey look my face. E be like say my face no kukuma fine sef. If una no answer me, we no go proceed. I want to make sure that you people understand what I said before I. It is a process where the formation of zygote embedding on the uterus. Latifa, did you visit Congo? Tell me the truth. Did you visit Congo? You visited Congo, right? Latifa, oh, see, you got it. You are correct. You are correct. He said it's a process where the formation of zygote embedding on the uterus, that is the discern definition. Implantation happen after fertilization. Yes, it's happened, but that is not the definition. It happens after fertilization, but that is not the definition. I don't know. I'm trying to add people that want to come in, but it's not allowing. I don't know. I don't know where they. Latifa, I know the word zygote formation and embedding is you got it from Google. It is when the fertilized egg gets settled in the super. This is simple English. Chisomo. Chisomo, you define it with your brain. Chisomo, you define this with your own personal grammar and this thing, which is very, very good. Good afternoon, Madam Tochi Anecheta Teresa. So let's proceed. At least few people have come to understand. But if you don't understand, do not hesitate to ask questions. Now let's go to the science. What are those things that will be happening to you? Then you might be suspecting that, oh, it could be that my baby is implanting. My baby is implanting. So the first thing is mild abnormal bloating on the 6th or 7th day after the fertile period. So, like, this is what I was giving as an example. If you OV today, for you to figure out this, for you to know if implantation have taken place, you must first of all know your circle. If you are watching me right now, you don't know your circle, I don't think that you can be able to dictate this. If you know your circle, the second one, you must know the day you OV. If you know the day you OV, then let's say you OV today, then maybe you on after 4 or 5 or 6 to 7 days, you start noticing mild abnormal bloating. You will say, when did I OV? It's like I OV the other day. You can't. Any date you OV, how you will know this? For those of you who know how to calculate your OV, any day you OV, mark it in your calendar. Mark it in your calendar. If you OV today, just after this program, go and mark the date you OV in your calendar. Then, starting from today, if you see any strange thing will happen, like lower abnormal bloating, you go know say, maybe in God don't bless me, maybe in my belly. And if you notice this, if you distress yourself, please stop it, just to allow it, because you can have what they call chemical miscarriage. You can, within that same circle, you fit carry belle, lose am, but you no go know, because some people they only know say they don carry belle when they no see their mense. So once you notice this sign, you need to relax, stop whatever you are doing that is stressing, because something is happening in your system. Mighty thing is happening. You need to give it space. You need to, allow it to happen. So I said the number one signs of implantation is mild abnormal bloating on 6 to 12 days post OV, after you don't OV. The next one is pinkish discharge up to 3 days after OV. Like there was a time somebody wrote to me and she said, "Ma, I dey see something where they pink, like say my mense don't won't come out. I don't know what it is. Is it infer?" I just she wasn't my subscriber, but all these kind of things, I'm a human being. I know that if I didn't tell her what it is and what she need to do, she might go and do something and she will lose the belle. So sometimes if people write to me, if it is something that needs urgent attention, I answer them. So I told her that she don't carry belle. She said no, but she never meet her mense. Her mense supposed to, and this thing will happen 1 week before you want to see your mense. She said her mense need supposed to start next tomorrow. Maybe na the sign, or maybe na. I said, are you listening to me? I'm talking to you. I'm telling you something. You are telling me another thing. I said you don't carry belle. Go and do test. You will see say you don't carry belle. So as I wrote that thing, I can't forget. She didn't reply again. It was like after 5 days, she came back. She said, thank you, ma. Oh, thank you, ma. It's true. It's true. I don't see my mense. I go buy this thing. I see her. Because of that itself, I didn't even post that test. I didn't post her testimony. Because I don't like when I'm telling somebody something, somebody will be arguing me. This is something that I'm very well, I know very well. I don't talk about what I don't know. If you ask me anything, I tell you I don't know. Believe me. But the one I tell you, I know it. So she was happy. She said she went to blood test and this thing, all of them comes positive. She said, but ma, that's pink, waiting in mean. I asked her, are you still seeing it? She said, no. I said, that is what is called implantation. You have been following me, but you don't know. So sometimes after your OV, you go to see something like after your OV, just watch yourself. This is just need calculation, attention. You will understand this. Just pay attention. Just pay attention. Watch in there. Be. How will I say it? Be a watchdog to yourself. No be doctor will come they watch you, come this. And only when you go doctor go look, see, tell you the one you see. There's there are ones you can do on your own. So some people after 7 days or 8 to 12, if you don't pass 12 days after your OV, that is no longer implantation. That could be your mense. I don't know if people are getting me. So I said the number one sign of implantation is mild abnormal bloating. That is after 6 or 7 to 12 days post OV. Then the second one is pinkish. Many people they ask me, I just dey laugh. I know they answer them because they are not subscribed. But that particular person that say she see me say the this thing don implant. So if I no tell am, she fit go do something, the thing go comot. Na im make I just answer am. So pinkish discharge, it might happen to 2, 3 days, even a day. How you go know? There's another one they call implantation bleeding. It will come like pink, but not too heavy. It might come just a day and stop. Some people, it might be 2 days, but not just spotting. That is the sign. Another one is another one is fatigue and drownness. When it is happening, this is a mighty thing happening in your body. When it want to happen, you'll be feeling like you are so tired or you want to sleep. Fatigue and drownness is the sign. And this thing sometimes is confusing because most of the time, the same sign you see when you want to OV or when you want to mense is the same signs that you will see when you want to, when this thing happens. So that is why I say you need to be calculative. If it calculates, who is asking? Adebosi, I will block you. I will block our people. They don't like respecting themselves. I am still here talking. You are asking me question. Yeah, God help me. If you are my new follower, even if you go to a party, a place they didn't invite you, when you go there, you pay attention. Somebody is teaching you, are asking question. So fatigue and drownness, when it happens, you may feel fatigue, you may feel like you want to sleep. Another one is mild but persistent headache. Sometimes when it's happening, you may have headache. Myself, when it happened, the signs that I notice is implantation spotting, like this pinkish spotting. That is my own. To pregnancy, it happens like that. So, and it's not a must that if you don't see this pink or any other, there are many types, there are many signs. It's not a must that if you don't see it, you will start bothering yourself. I know a lot of you now, when month end, the month will not end, you will start bothering yourself. Oh, mommy told you say you will see this. It's not a must. Some people don't see this thing. You might see other signs different from what I'm saying. So mild but persistent headache, you'll be having headache that is like coming and going. That is the sun. Another one is sore and swallowing breast. This one also happened to me. If you have not carried belle before, or you have not given birth before, you will see immediately implantation happen. If you go to mirror and check your nipples, you will see that they will become dark and they will be sore. I don't know. That is the signs of implantation. So after then, when this implantation happen, after 6 weeks, then immediately implantation happen, and maybe going to 6 weeks, you will now start noticing signs of pregnancy. So if you have any question, you can ask me now. Please ask me reasonable question. Adebisi, I'm not going to answer your question because you interrupted me when I was teaching. Please, if you have any question, you can ask me now. If you have any question, you can ask me now. Please, if you are joining us, like, follow our page, and God will bless you. And in my that's why people don't learn. You cannot just go. A reasonable person, if you are smart, when you go to a group, any group, depending on me, I am an organized person and I like discipline. If you go, you listen. When you listen, you learn. How can you just go into a group, you jump there, you ask questions, and what you are asking might not even literally be in what the person is teaching? It distracts. When I'm teaching, I don't look at the comment section, because if I look, it distracts me. So that is my own. Other group, if they are doing it, that is their method. My own, I am organized. I am teaching people to learn. I am not teaching people to come here and watch me. After watching me, you will not understand anything, you will go. Everybody is participating. I want everybody to understand. That's why sometimes I throw questions. So my own, I organize it. My own is not other groups that you can go, you ask anything. Whether the one they know, they will tell you. The one they don't know, they will tell you. Me, if you ask me, I must make sure you learn, so that if you learn it, it remains there. It will be helpful to you. Not all about going about asking questions. Like there is somebody I see, every group you see her, she keep on asking the same question because she doesn't want to learn. When you want to learn, you settle down and you learn. Not all about going to 1 million groups. At the end of the day, you will not achieve anything. That doesn't make sense to me. um I don't know why I cannot see questions. I don't know what I press in my phone. Please let me use mommy. Please no first. Let her not run. No, I'm not angry. Hi, Mary Star, you have not even understand me. I'm not angry. Is it my way? Sometimes, even though you both people, they said my face, I'm always mean. I'm not angry. That is how it is. I'm not angry. Why would I be angry? I'm just telling people the truth. It's not all about going to many groups. When you go to like somebody like me, even if I watch a movie or program, I join anything, I'll be listening. I always go with my pen. At the end of the day, I'll ask myself, what did I learn from this thing? So if I didn't learn anything, I will not go there again. No. Remind this program, you will get your answer. Okay. Okay, ma'am, please. Today is the 9th day after my OV, and I have been experiencing waist pain. And wow, we are like say with the hey, it is going to be great this month. Jesus Christ is already here. Who is this? Ijoma Ike Raphael. Ije, you don't enter. Please don't do any strenuous thing. Waist pain. Before all of my pregnancy, I experienced spotting and nipples hot. But this our baby now, it was this signs you see, waist pain. Be like say person carry something, take scatter. I no fit stand up. It was like I was like, what is this? I'm not old. Why is my waist paining me? I don't know. Say it don't enter. So Ijoma in next week, you will come here to testify. Congratulations in advance. Mind the way what you eat. Don't go carry your mind put here. From what you are saying, you said it is 9 days, which means it don't already implant. Remember, I told you um 6 to 12 days. So 9, 6, 7, it don't implant. Congratulations in advance. You see why you need to learn. Good afternoon, ma'am. I told you about 2 seconds now. I have not experienced so. It's not a must that you experience. Like I said before, there are different. Everybody with their own. Every baby with their own style. There is some way go come self. You no go even know say you carry belle. Your body go there. There was a video of a woman I watched. This woman get belle for 5 months. She no know. 5 months, so she no know. She still dey say her mense. She dey even on top dey jollificate with oga. She no know. Na when she go for her normal dis thing, the doctor come dey tell am say she no believe until dey use scan show her. So all this baby, that's why I tell you sometimes you go even this last one wey I give now. I dey tell you, I dey always dey watch that implantation. You can't use another side. I no even know. Na when this thing come dey pay me too much, na drag my attention. So Make you no go worry yourself or dey kpai yourself say mama Tochi said this. Every pikin get their own way. E get one wey wan surprise you, they no go even tell you anything. They go dey there. If you like, do them anything. You never see people wey go. There is, I will give you experience for my neighboring village. There is one all these small girls now, and that girl im papa no get male child. So she dey secondary school, she go carry belle. So you know say for our place now, when person carry belle, the na taboo, the person don do worst thing. So she no wan make people know say she go remove am o. She no know say the pikin no gree comot. For her mind, she don remove am. So after like 1 month again, she come dey feel dis thing. She go, doctor tell am say you no complete. She go another place, dey tell am say you no complete the removal of the pikin. She say make dey remove am. Dey remove am again. No know say the pikin still dey there. You no know say the pikin still dey there. She go the next one, dey tell am say if you try am na kpai be that. If you try am, this your head no go comot. Na im make she carry am. Even the doctor dey come dey tell am say now you don disturb the pikin well. The pikin fit be half semi-imbe. So na so she carry am o. Come born am na boy o. And as I dey talk to you now, na that boy be the boy wey dey for their house now. Big boy. Na im she wan go kpai like that. So e get children wey their head be like coconut, dey strong o. They go say make I surprise my mommy. So if you no see these things, make you no go dey bother yourself. When you go enter, if you carry belle, the belle go be there, nothing go happen. After implantation, can we do? I didn't, Flora, I didn't understand your question. Good morning, Matochi. I am experiencing waist pain, eating a lot of. We don't get. You see, I told you guys. Please, how many weeks? When did I tell you people say it go dey start to the rain here? When did I tell you people say it go dey start? You don't they say it so. Two people now, don't they ready? Hey, Omekwala yozo, Omiyuku Jehovah. Flora, go and do pregnancy test. Both of you should go and do, and you write me messenger. Good morning, Matochi. Heaven sent angel. This is your name, fine. No, heaven sent angel. Is this your real name? You don't they say it here now. People will join us with their faith. You don't they say to. I hope say my messenger no go bust. Please, can you explain, and also when exactly does this start? Who is this big madam that is asking me this? Well, I don't blame you. Anybody can join and watch the line. Good afternoon, Matochi. About okay, ma. Please, today is. I think I have answered all these questions. So, if you join us in the prayer, continue to pray. Ma, I miss my for 3 days now. Ma, good afternoon. I do understand. Sadikwe. Sadikwe, if you miss your menstruation, the next thing you go do, you do pregnancy test now to find out. Sometimes stress and the infect can make you to miss it too. So I urge you to do test. Of course, Ajobi will come for say I will testify. How are you? Please, thank you very much for all your teaching and your channels. I tested positive today on my Ovila, and today is my 17 days of 25 circle. May God continue to bless you. Thank you. Yes, it's happening. Congratulations. The next one will be Bele. The next one, you will carry Bele. I'm next to testify. Matochi, that's not my real name. That's my you see. So if person want to locate you now, what would they know? I know the name. The name is sweet for Facebook. It's a sweet name. So if you join us, please, who will go outside, copy our backup page link and post it here so that people will join us. Good afternoon, ma. God bless you for your teaching. Please, ma, after my monthly 3 days ago and yesterday night, I start to take my glow, but my waist is disturbing me. Then you go to the hospital and check why your waist is disturbing you. Have you OV? Have you OV? How are you doing, ma? Please, thank you very much. Okay. During that implantation period, is anything someone can do after OV to enable the pregnancy so that not after having the implantation sign, the period will start? Well, I'm going to, like I said before, I'm going to be talking about how to support implantation, what you can do to have successful implantation. Maybe next week we will talk about it. I'm going to make the video. It's not what I can say here, but if you have low progesterone, it cannot stay. That is just the fact. If your progesterone level is low, it's not going to be successful. If your estrogen is 40, it's not going to stay. How are you doing, ma'am? Please, thank you very much for all your teaching and your channel. Okay, I've answered it. Why is this thing repeating? Ma, that means I have to avoid my husband because I don't want. Yes, yes, yeah. This is. I want to. Some women body, our body differs. For me, when I was trying to carry belle, after my OV, I no dey do anything again until I see the positive result. I'm not saying if you do anything, something may happen, but I just want to be the Dutch says sicher. What's the English word for this? Sicher. 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 Dutch don't eat my mouth. Sicher. I just want to be careful. Ghana. I just want to be careful. So some women, their cervix, and have you heard about incompetent cervix? So maybe if you don't like now, this thing have implants now, it's still in form of that thing where they read. So if anything hot can make it to come out. So what you need now is to pamper yourself, be careful, but anxiety and stress off. If you enter into anxiety, your menstruation go come out again. Just make yourself happy. You join us in the prayer, right? Believe you are already carry belle. Be doing your normal, take your mind out, far away from it. Even there is somebody that I was following that time. There was a time I used to follow people up. I told her she carry belle. Every day when she do the test, it came out positive. But every day she said, "Maha, I need to be doing the test every day to know whether the thing is still there." I said, "Ha, what kind of human being is this? These are women of little faith. Don't go and be testing every day. Once you test one and confirm, then you realize. Don't be, especially people who have been trying for long. When it happens, they don't believe it. They will be doubting themselves. So you don't do that. When you are doing that, you are putting anxiety into your body, and you might miss, you might lose it. Good day, ma. Please, a period that comes out from normal fertility. Depending on how, no, it's not supposed to be drawing. It's supposed to be the normal ways. If it's drawing, maybe you have 5B or endometriosis or infect. These are the things that can make it to be drawing. Good day, ma. Okay, please, ma. I saw my on the 18th, and last week I have been noticing pain in my. The issue is this. You see, the people that we are writing, they were saying the day they OV. Do you know when you OV? I cannot say you don't carry belle, because these are also the signs of menses. So if you actually know when you OV, it will be easy for you to calculate this. Okay. So what's the time? Please, ma. So if you joined us in that prayer, I want you to be prayerful. Don't give up hope. Don't say, when are you going to testify? Just let your faith be strong and it will happen. Hello, sister, watching you all the way from Zambia. I'm learning. Thanks for this powerful lesson. Thank you, sweetheart. Can somebody please go out, copy the link of that video, Linda's TV show, post it here so that my people will follow our page. Wetin I do on Anna? See, as on a day here, they ask me question, I they answer. Nobody want to. Who's got people I get here? Please, somebody, you will become, you will become, you will receive, you will receive gift from me. You see me missing English and Dutch. Sometimes even my Oyibo friends, I speak Igbo for them, concern me. When I speak Igbo today, they will say, hey, madam, you are not in Nigeria. My brain will come out. Sometimes I speak English to them. What can I do? In a country, I speak how many languages? I speak English, I speak Igbo, I speak Dutch, that is German language, I speak French a bit. So sometimes I will be mixing it. And I don't want that Dutch language to enter my mouth. It's trying to take my English away. I like English because anywhere you go, you can express yourself. But Dutch is just few countries that speak Dutch. So one of my friends that I even came here before, she cannot speak English again because Dutch have entered her mouth. So me, I'm trying everything possible to make sure that I retain my English. Good day, ma. I've been following your post. What is causing? If you ask me this question, I will go Winifred. Yesterday, I treated this topic you are asking me. Yesterday, if you are joining my page, please always watch my previous videos. This topic you are talking about, breast discharge, is I made a video yesterday, live teaching. Go and watch it. You will see the answer to your question. I am also from you from Zimbabwe. You are welcome. You are welcome. I'm waiting for somebody to share that link. If you wanna not share them, I'll not go there happy. Somebody should go out and copy the page, Linda's TV show. So continue to pray. And when you see strange thing happening to your system, if you want to help yourself and help me also, try and go and learn. No, post it here, share it in this broadcast, share it here so that it will be easy for people to follow. If you see anything like now, maybe your medicine they come out every month, something should tell you that all is not well. If your menstruation is coming out too much, the way it should not, you go to the hospital. If you are not over, you go to the hospital. Don't just stay there. Don't self-medicate. Some people, they treat themselves. It's not good. That is why the doctors are there. The doctors are there for you. So when you have any issue, contact your physician. Sometimes when you tell people to go to hospital, they feel, don't give up hope. See, in this life, stress cannot help you. Stress it can make your situation worse. Happiness will make you achieve everything. A lot of women trying to carry belly, stress is what is holding them, but they don't know. When you ease yourself, there is somebody that I've been having many experience with people. When you talk to me, if it is what I know, I already know what you are suffering from. I will tell you, this is your problem. Remove it. Stop it. She always complains she have gone to everywhere. Nothing is wrong with her, but she cannot carry belly. I told her that you are the one holding yourself. She was shocked. She said, how? I said, because you are stressing yourself. Off yourself. Remove stress from yourself. You will see you carry belly. She did it within 2 seconds. She carried belly. So, my dear sisters, I understand. I know how you feel. I know how it feels for you to marry 2 years, 3 years, 4 years, nothing to show. Yes, but then adding up stress cannot do you anything. I know how people talk about you. they make use of you, they say this. They, as long as what they are saying cannot give you food, close your ears, make yourself happy, and you will see yourself carrying your belly. My please, I lost my pregnancy 2 years ago, and since then I haven't seen my mense. I've gone to the hospital, but they keep giving me different medication. But recently I started feeling pain on my, well, I would also advise you to go. First of all, can you go and find out what led to the first one? What make you to lose the first one? You have to fix that issue. Some people, all they are interested is they will have like 4 to 5 miscarriages. It doesn't bother them. They still want to. You have to find out what led to that first miscarriage. What made you to miscarriage first? You fix it before you start trying to carry belly. Good afternoon, I'm watching you from Guinea Bissau. Well done. Wow. Onwemenu Ejiako, you are welcome. Good evening, ma. I have 5B. I always feel pain on my stomach and my back is always hot. That is the sign of 5B. It's your doctor that need to tell you. If you have it, avoid, go to my page, watch the video I made. Was it in a live video? Was anybody here the day I talked about? I think it's in a live video I made about food that people that have 5B should avoid. Then if you avoid it, it will help you to ease. So my lovely people, I have spent over 1 hour here. May God Almighty bless you. Don't give up hope. By next week, it's going to be raining. I have many distinct tests people post. I wanted to post it after I posted that woman. She waited for 9 years. 9 years, no be 9 days, so no be 9 months, so 9 good years. Do you know the trauma she have been? And God bless her with 5 at once. So anything God cannot do does not exist. So that was why after I posted it, I forgot to post other people's testimony. It's raining here every day. So keep on believing, continue to pray with your partner. Let's see how next week is gonna be. It's gonna be raining here. So thank you so much. Enjoy your weekend. Make sure you go to church tomorrow and make sure you keep trusting in God, and God will definitely see you through. God will never abandon. He said, I will not disappoint you. I was very sick. I did pregnancy test, but it wasn't showing. I did malaria test. I started treating malaria. So I think that was the reason I lost. You see, you see, you just make me to be angry. Ojota. I have been giving, when I'm saying all these things, you guys think that I'm crazy, that I don't know what I'm saying. Don't do self-medication. I explained to you how somebody lost her belly because of self-medication. This thing you did now, when anybody that is in Nigeria, when they are sick, it's malaria, it's typhoid, are you a medical practitioner? You are a woman that tried to carry belly. Anything that happens to you, please, can you go to the hospital? Stop going because if it's a chemist, what do they call them? Pharmacies, they are open. Even pharmacist is good. When you go there, there is some medication they cannot give to you. It's because of those medication you take that you lost the belly. If you want to treat malaria or infection, treat it before you start to carry belly. But if you're a woman that is trying to carry belly, if you are sick, even if you get that malaria, don't treat it. Go to doctor. They have the one for women that is pregnant. Don't do self-medication. It's very, very bad. Look at what it have cost you now. This is malaria, any anti-malaria, any antibiotic, any medication. The only thing a pregnant woman is supposed to take is allowed is paracetamol. Even immediately you OV, you don't take ibuprofen. You don't even take paracetamol. Once you OV, don't take any medication, especially all this pain medication. So you just spoil my very good mood now. No, you cannot talk to me privately. If you want to talk to me privately, you can subscribe. And I don't give anybody my number. So thank you so much. I don't like what you did. Have you not been following my teachings? Baby, that prayed. We prayed. I have been saying it. Anything you don't know, don't take. Anything that is not being prescribed by med. If you are sick, go to the hospital. This is this thing you did. It's exactly somebody that I was monitoring, following her. I made sure she carry belle. When she carry belle, she not even know because she was ignorant. She just left herself. She just left herself. And after taking antibiotic and all that, she remember she would tell me. By then, the baby don't cry for her belly. Oh, God. Well, I will pray for you. God that did it before, since it's as a result of ignorance, he will do it again. So thank you so much. If you want to ask me anything, you can subscribe. If you want me to follow you, like the way some people want me to be following them, you tell me. You go and pay 200,000 naira, then I will follow you. In fact, we'll go to chat, they discuss. So thank you so much. May God bless you. So thank you so much.